And formally introduce Amy, who will be giving a presentation from the Livable Communities. Thank you.
All right, good morning, everyone. I have to admit that I'm officially recovering from the flu or the fog of the flu of taking care of children. Show of hands, this is my public service announcement for all of us here to wash our hands. How many have been affected by the flu this week or last week? Oh, you're good public health. Okay, we got the flu shot. We got the flu mist. We still got the flu. Unfortunately, it's just the case. So I have to thank Luke Hansen for putting together some of these slides and the leadership for being very gracious and understanding that I was a little under the weather and unreachable this past week. But what I do have to report today is Livable Communities, it's been such an incredible opportunity to participate in the group here over the last 2 years. And here is our goal: increase active living and improve environments. But I think what's really important here, we all talk about multi-sector and multi-level approaches, but I think it's so unique to Livable Communities. Nobody really wears that hat. And so when you see all these different organizations and groups coming together into the room to build healthy environments, it's really powerful, and it really lets you know that there is that collective impact that we hear about, and that and together we are stronger, which is what we're hearing over and over the course of today. But I do believe I have some great things to report to you, and of course we have some further work, and we have some exciting work that you'll be hearing about later on this afternoon as we look at optimizing the built environment. Okay, so this is just a list of some of the participating organizations, so I apologize if you're not up there, but we've had a great group participating over the last several years, and we've had some really good leadership, and we've had some collective successes. So I'm going to highlight just a couple of the things that we've done over the last 2 years, but knowing that there's some great successes, and that's part of being part of the Health Action Partnership in these groups, is celebrating each other's successes and understanding that owning that in this space is very powerful. A lot of times we don't have a chance to reflect, and this is that time that we get to reflect on all the accomplishments that we've done, and it's really important to do that and to take that time to celebrate each other's successes. So we were really pleased that the City of Birmingham was accepted in the STAR program, and the STAR is a community rating system. It's one of the first of its kind. It was basically launched in 2012, and it looks at the sustainability of a community. And what's so empowering about this is that it looks at it as a whole, and there's a tremendous amount of baseline data that had to be gathered. And today, I definitely want to recognize, I know Tanisha Washington is here, and she spearheaded pulling together 260 pages of Excel spreadsheet documents with items across a lot of different areas. And it was really that in and of itself, pulling that together with groups who know about the water quality in the air and also about obesity and other economy issues. It's just very, very powerful. So here you see a list, and we were proud to be some of the pilot programs for this 2014 progress report. And here are the areas that you'll see. There's 7 areas and over 40 objectives. And you can see that it doesn't just look at health. It looks at the economy, because we know that a healthy economy, it means that we need to be at our best. It also means that we need to think and install resiliency. We need to know and bounce back from adversity, so when something happens, we're better able to respond to it. We know that it fosters innovation, which is so important, so it enables those individuals to take the risks that are needed to think about health and public health practice and improving our communities together collaboratively. It redefines progress, not just about the economy and the dollars spent, but also about those individuals and the health and well-being of all of those individuals, including those that are underserved. It cultivates collaborations, it ensures equity, and it also inspires leadership so that we know we have to measure our progress. We have to have a baseline, and we have to know where we're going. And it also continuously improves. So what we're showing you here, we had a lot of objectives, and I'm only highlighting a few of them, but we've known that our target is sometimes moving, and when it moves, we follow, and we readdress, and we realign with what we need to do to be successful in our endeavors. So one of the endeavors I'm going to talk about is the Walk Birmingham, with the leadership of the Freshwater Land Trust, and Ryan Parker, I believe, is in the room. and as well as Nick Sims, who's been our undying support from United Way and with his Safe Routes to School work as well. But this was funded through the Public Health Advice Fund, and these are actually handheld walk cards that are established in 2 communities, and it will be promoting physical activity. And we had a great community engagement process. We all know that we're supposed to work at policy, systems, and environmental change levels, right? But the community engagement part, that's what's so exciting. And I have to tell you, we took our show on the road. We would go out every other month and we'd head to a local 5K. We'd support each other's works, ribbon cutting of opening of trails. And that's where you really get out. You're not just sitting in a room speaking to the choir, but you're out in the community, seeing what's going on and really celebrating each other's successes. And the walking cards are very, very usable, very user-friendly, and they are going to be, we hope it's going to sprout this interest. Once people see it, other communities, other areas are going to want to do it. So we did use that very, very much, the participatory action research focus on that, so that individuals could have their input, so that they know that they owned it. And the 2 areas that are being identified were downtown and also East Lake Community. And you can see that the reach is phenomenal. And we also had some great partners working together on this, so it's not just the one entity or even the funded entities. That's the funny thing, is when you get in a room together, you say, oh, well, that's kind of my space, I do that. We have to do that anyway. I have a grant, you have a grant, let's try to work together. Or that's our organization's mission or our community organizations group goal to really improve this area. So together we all brought this out. And the report, we had the benefit of working with Cayenne Creative as part of the funds. And they really came out with some great signage. And at the Tempo event, we were able to test them out. And what's so cool is when you finally know it's only a 12-minute walk, or it's only a 5-minute walk. What does that mean? And you know, AARP went out and did an actual assessment of the environment so that we know that it's accessible, that it's going to work for the people that I serve at Lakeshore Foundation, people with disabilities, and that it's going to serve older adults as well, or 40% of those over the age of 65 are more likely to have a disability. So, and it's about safety as well. So we'll talk about optimizing the built environment later on today. But when issues like transportation and safety are so big, we think, oh, I can't even tackle that. But that's the great opportunity that you have a chance to be involved in over the next several years, is really addressing some of these large issues that the whole of our community can benefit. The next steps for the Walk Birmingham campaign is really to get the cards out there, to get people utilizing, and of course to evaluate our progress and our work and determine what was done well and what we need to further extend to the community to engage healthy living and to utilization of active transportation within their environment, so they know it's only a few-minute walk to the local grocery store. Or perhaps we look at, if there isn't a local grocery store available, what can we do? How can that community be engaged to ask for that farmer's market to be located within their neighborhood? So I think it's really important to, like I mentioned, to celebrate our successes. We've had that opportunity. We really look forward to working on these issues as well as transportation and safety in the future. So I really encourage those of you that may be an interest, please come this afternoon and let's talk about these big issues that need to be addressed for the all and the betterment of our community members. Thank you.